What India is doing, as I said in my statement, is very, very important. During shutdowns, there will be economic consequences on the country at large. But more importantly, individuals who live on daily subsistence, who give their labor for their daily bread, could be affected the most. And that's why India is taking measures like the 24 billion US dollars package. And not only that, this will cover 800 million individuals as food ration during the difficult times, and cash transfers to 204 million women. And of course, 80 million households will also benefit for the next months from getting free cooking gas. That's the kind of support we said it should be given. So we should not see it from the public health part alone, but see it from the angle of what the consequences of these public health measures will be on the community, and try to support our citizens.
The India story is unique in that the country was able to deploy not only the COVID vaccine to a huge number of people, but also to use technology to augment that deployment, and to be able to better deploy services and track the vaccine deployment. And the reason why India was so successful is because there was already an infrastructure to start from. There were national policies in place. There were sort of data security policies, and many countries did not have that. And so they were starting from scratch. They were taken by surprise. And in a pandemic, you don't want to start setting up these systems in a rush. It really takes time. So many of the other countries, especially low-income countries, were completely unprepared. And when you have a fragile health system already, that is already struggling with the numbers of health workers and supply chain, adding digital technologies is difficult. I think we have a lot to learn from what India did in terms of creating a health information structure, having the right policies in place, using open source solutions that can share data between programs, and that is open source. So there are a number of both software solutions that can be exported and where India can provide a lot of expertise, but there's also the know-how and the policies and practices that India put in place, how you train the health workforce, how you set up these structures for interoperability, policies, data security, etc.
I'm pleased to say that the improvements in the Indian health system over the last decade have been very, very significant. It was referred to that new vaccines have been introduced for diarrhea and pneumonia. The vaccine coverage, even in some of the states where the coverage level was quite low, has been improved quite substantially. Now, almost 90% coverage. There are specific disease programs like Kala-Azar that's made very good progress. The TB program is also very ambitious, doing some things here in India that haven't been done anywhere in the world. And also polio was mentioned. It was back in 2011 that India had its last case of polio. And there was a time when it looked like India might be the last place in the world that had polio. The difficulty of getting everyone, with the floods and the high level of coverage you need with the polio vaccine seemed very daunting. But the Indian government stepped up, did a great job.
Coming back to COVID, COVID turned our world upside down. No one had an idea the impact of COVID, how it is going to be treated, what is the outcome, what is the modality of treatment. We had no idea. When COVID struck India, Mr. Modi declared early lockdown. There were a lot of questions. When we have only few thousand patients, why go for a lockdown? But retrospectively, in less than 2 months' time, everything changed. We not only produce enough PPEs for ourselves, we could become net exporter of PPEs. We could become net exporter of ventilators. Everything changed. All this happened because of the early decisions taken by the government under the leadership of Modi.
I think the third most important thing, if I were to look at, is just the way India has dealt with the pandemic. While it is a global pandemic, remember, we are a resource poor country. We are not a rich country. So while most people think and compare ourselves to the OECD rich nations, it's important to note that for a country like ours with limited public health infrastructure, it is quite a remarkable feat how quickly the testing architecture, if you look at the vaccination drive, today, more than 900 million people are fully vaccinated. That is a remarkable feat. And this is all on the back of really effective leadership and efficient management.
But what was for me very exciting and positive was that science and technology was really driving our response to the pandemic, and ultimately it was science that found us the solutions. And India has done very well, so the whole world is actually looking to see how did India actually roll out the digital architecture, the stacks on which the health stack was built, and we know that for financial application also, and we started, of course, with Aadhaar and so on. So I think that process of having built it very thoughtfully enables now all of the startups that we see to leverage that the roads have already been made, and then you can bring your applications and put it. Now many countries are not like that. They're doing piecemeal. Different companies come and build different things, and then they try to see how to integrate. But here we went about it the right way.
When she came here for the first time in 2019, and now they say there's a big improvement in eyesight, but they said that there's still room for further improvement. Actually, I've discussed this matter even with the Prime Minister Modi. I've told him this spectacular story. He was, of course, very excited, and I've told him that we would be very happy to work together in this. This would be like one of those called South-South cooperation to bring this technology to Africa.